Okay, hi, I'm Allison. I'm going to be your nurse for today. Can you tell me your name and date of birth?
Yes, Kendall McDonald, 11701.
Okay, we're going to be doing a head-to-toe assessment today. I have all my supplies. I'm going to close the curtain and put on some hand sanitizer and some gloves. Okay, there's no trip hazards. The room looks pretty clean. And then the mobility, weight, and height are appropriate for the patient. Do you know why you're here?
Just for a head-to-toe assessment.
Do you know where you are?
I'm in Alter.
And then do you know what year it is?
It's 2022.
Okay, patient is alert and oriented times 4. Okay. Yeah, okay, so, do you have any changes in mood recently?
No.
And have you had any change in your sleep patterns?
No.
Any changes in general?
No.
And are you in any pain today?
No.
If the patient was in any pain, I would do a cold spa. Okay, so now I'm going to inspect your head. Okay, so the head shape is normal cephalic and hair distribution is even. I don't see any bumps or lesions or anything. And I'm going to feel your temporal pulses. They're 2+ and symmetrical. And then I'm going to change my gloves. Can you even see? You can't even see. I'm literally standing right in the way. Okay, I'm going to change my gloves and then, okay, so now we're going to look at your, I'm forgetting something. Okay, can you turn your head against my hand? And then this side. Okay, so that is spinal nerve number 11. Spinal accessory nerve. Okay, and then can you smile and then frown and then puff out your cheeks and show your teeth? That is number 7 facial nerve. And then I'm going to feel your jaw. Can you clench? Okay, that is number 5 trigeminal nerve. And then, yeah, okay. So we're going to look at your mouth now. I have my pen light here. Can you smile for me? Okay, can you actually just open your mouth? Okay, can you stick out your tongue and say ah? Okay, that is number, your uvula rises with phonation. That is number 9, glossopharyngeal. And then, right? Yeah, okay. And then, can you stick out your tongue and move it side to side? That's number 12, hypoglossal. And then, inside of your mouth is pink and moist, and the teeth are intact. None of them are missing or broken. Yeah, okay. Do you have any problems with taste?
No.
That is 9 and 10, glossopharyngeal and vagus. And then do you have any problems with swallowing?
No.
That is also 9 and 10, glossopharyngeal and vagus. And then taste, swallow. What's the other one? I can't remember what the other one is. Okay. Yeah. Okay. Okay. And then, yeah, we're gonna get back to that. Now I can't remember. Okay. I'm gonna look at your nose now. So can you cover one nostril and breathe in and out, and then the other side? Okay. And then, do you have any problems smelling?
No.
Okay, that is number 1, olfactory. And then, I'm gonna look inside your nose with my pen light, and then, my pen light's dead. Okay, it's not actually. Okay, yeah. And then, do you have any nasal drainage or anything?
No.
Okay, that's good to know. Are they both broken? Okay, great. Okay, and then, yeah, okay, I'm gonna do your ears now. Do you have any ear pain?
No.
Do you have any drainage from your ears or anything?
No.
Do you wear any hearing aids or devices?
No.
Okay, can you cover one ear and I'm gonna perform a whisper test? Can you hear this?
Mm-hmm.
And then the other side?
Mm-hmm.
Okay. Okay, so now I'm going to do the neck because I totally forgot that earlier. Okay, so, I'm going to feel your carotid pulses first. Okay, 2+. I forgot vitals, 2+. Yeah, we're about to do that in a second, don't worry about it. All right, yeah, and then I'm going to listen for any bruise with the bell of my stethoscope. How did I forget vitals? That's why I'm so thrown off right now. Okay, I don't hear any bruise in either side. Oh my, okay. Okay, and then we're going to, what's the other one? Okay, I'm going to do your lip notes first, then we're going back vitals. Okay, so preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical. Okay. I'm going to change my gloves because we're about to go back into vitals because I totally forgot that earlier. Okay. So, okay, this is my nurse on a stick. We're going to use this thermometer. I'm going to put this under your tongue. Okay. Beep, beep. Okay, 98.6 degrees Fahrenheit orally. I'm going to put this O2 stat on your finger. Beep, beep. Okay, it's at 100% on room air on the right finger. Okay, and then I'm going to feel your pulse on your wrist. Okay. 68 beats per minute, right radial, 2+ and symmetrical. Feel this on too. And then I'm going to count your, okay, and your respirations were 14 per minute, deep, non-labored, and room air. Okay, and then I'm going to check your blood pressure. I'm going to put this blood pressure cuff on you that is over here. Okay. Do you know where your normal systolic is?
Usually around like 110 over 70.
Okay. Okay. 120 over 70. Very nice. And then the left brachial patient is sitting and is a manual blood pressure cuff. Okay. Now that I just totally changed that all up. Okay, so we're gonna go back to the eyes. I didn't know. Yeah, okay, we're going back to eyes. Okay, so can you look straight ahead for me? I'm just gonna look in here with the light. Okay, pupils are 4 millimeters, and they are round, reactive to light, and equal in size. And then can you follow this pen for me? They also accommodate objects. And then can you, this is 6 cardinal fields of vision, just follow my pen. And that is 3, 4, and 6, which is ocular motor, trochlear, and abducens. Okay, and then can you read my name tag up here?
It says Allison Feldman.
And then can you read it from back here?
Allison Feldman.
Okay. I'm also going to look at your eyes again. I'm going to pull this down. Okay, conjunctiva is pink and sclera is white and intact and moist. Okay. Okay. All right, I'm gonna step back and look at your skin now. Okay, I'm gonna feel the temperature of your skin. Okay, temperature is warm and not too dry, not too moist, and colors appropriate for ethnicity. And then I'm gonna check your pulses here. This is radial, 2+ and symmetrical, brachial, 2+ and symmetrical, and then dorsalis pedis, 2+ and symmetrical, posterior tibialis back here, 2+ and symmetrical, and then capillary refill in your toes, 1 second return, 1 second return, then capillary refill in your fingers, 1 second return, 1 second return, and then I gotta check your skin turbor and your clavicle.
You touch the thing.
1 second return, and then edema in your wrists. Let me check. No edema, and then I'm going to do 2-point discrimination. So you just tell me if this is the sharp versus dull. Tell me if this feels sharp or dull, okay?
Okay. Sharp. Dull. Sharp. Dull. Dull.
And then next we're going to be doing lungs. Yeah, lungs. Right. Okay. Yeah. So, do you have any shortness of breath?
No.
Have you been having any chest pain?
No.
Any sort of cough?
No.
Okay, good. I'm going to listen to your lung sound. Just take a deep breath every time into my stethoscope. And then I'm listening to your lead. Okay, I didn't hear any throat friction rubbing or cracks or wheezes in any of the lung sounds. Next, I'm going to listen to the heart. So aortic, pulmonic, herbs, tricuspid, and mitral. Okay. I didn't hear any cracks and wheezes. I heard S1 and S2 in the appropriate places, and then if I heard any clicks or murmurs, I would have the patient lay left laterally and listen with the bell of my stethoscope. Okay, so next we're going to do bowel and bladder. So have you had any changes in your bowel or bladder movements and habits?
No.
What was the consistency of your last bowel movement?
It was like brown and soft.
Perfect. Is there any pain when you're urinating?
No.
And what color is your urine?
It's like pale yellow.
Okay, that is good. Are you staying hydrated?
Yes.
That is good. Okay. What have you eaten in the past 24 hours?
For lunch, I had a sandwich. For breakfast, I had oatmeal, and for dinner last night, I had a turkey burger.
Okay. There's another one, but I can't remember it right now. Okay. So now I'm going to listen to your bowel sounds.
Okay.
That is okay with you. Okay, starting the right. You can't even see. In the right lower quadrant. I could listen for up to a minute in each spot. Up to 5 minutes if I wasn't hearing anything. Okay, bowel sounds are normal active and loud and clear in each quadrant. I just remember the other question. Okay, what is your fluid intake compared to your urine output?
I'd say I drink a lot of water and I pee a lot.
Okay, that is great. Good to hear. And now I'm going to, I'm going to listen for bruits in the abdomen as well with the bell of my stethoscope. So aortic, renal, iliac, femoral. I don't hear any bruits. And then I'm going to palpate now and feel it for any tenderness. Tell me if this hurts at all. I don't feel any masses or anything.
Doesn't hurt.
And I'm going to palpate your bladder. Doesn't feel distended or anything. Okay, I think that's it for that. You can sit back up. Thank you.
Mm-hmm.
And then you can just dangle your feet. And then can you cross your legs? And then cross the other one. And then can you pretend to brush your hair? And then can you reach down and tie your shoes? This is such a bad angle. Okay, and then can you can you spread out your hands in my hand? And then can you pull back and then push up and then push down on my feet, and then push up, and then arms, and then what? and then can you get up
Yeah.
and walk a couple steps? Okay, now go back. And then, is there any drainage we didn't discuss?
No.
Okay. And then, I didn't notice any drainage that we didn't discuss. Okay, and then I'm doing this, kick. Oh, you don't have to actually kick. Just do it over your patellar reflex. Okay. I would rate those a 4. And then muscle strength was symmetrical for all of the upper extremities and lower extremities, and I would rate them a 5. And the patellar reflex gets a 4. Okay. Gait, when I had her stood up and walk, that was symmetrical. Arms were swinging smoothly. Yeah. No pain today.
No pain.
Yeah. I think that's it. I think that's it. Okay. Oh, I'm gonna lower the bed before I try to do anything else. I'm gonna lower the bed, make sure my patient is safe. Lower the bed, put up the side rails if necessary. Are you comfortable?
Yep.
Do you need anything?
Nope.
Okay. Thank you.
Oh,
What did I forget?